Hi all. Let's study the clinical anatomy of the bones and joints of the upper limb. I am Dr. Komlayan, Professor, Department of Anatomy, Ramya Medical College. All images and videos used in this presentation are from the textbooks of anatomy and various internet resources. The images used here are only for the teaching learning activities. This video is done to help the undergraduates understand the clinical anatomy. I acknowledge the ownership of the images and give complete credit to them. The objectives for today is to study the fractures of the bones of the upper limb, clinical anatomy of the shoulder joint, elbow joint, wrist joint and the small joints of the hand. Fracture clavicle. This is the most commonly fractured bone in the body. The fracture usually occurs at the junction of the middle and the outer thirds because this is the weakest point. This fracture occurs due to falling on the shoulder of the outstretched hand. Humerus can get fractured at the head of the humerus, greater tuberosity, lesser tuberosity and at the surgical neck. More, humerus can also get fractured at the shaft, supracondylar area, the medial epicondyle. In this type of fracture, the radial nerve gets injured. Here, the ulnar nerve gets injured. Another fracture called as Holstein-Lewis fracture. There is an oblique fracture of the humerus at the middle and the distal third. The radial nerve, while passing through the intermuscular septum, gets injured when there is a fracture. Monteggia fracture. This is fracture of the proximal third of the ulna and there is dislocation of the radius. Galeazzi fracture. This is fracture of the distal third of the shaft of the radius. The distal radio-ulnar joint gets dislocated. This is Colles fracture. This is fracture of the radius proximal to the wrist joint. Because the deformity is like a dinner fork, it's called as dinner fork deformity. There is shortening of the radius and there's dorsal angulation seen here giving this dinner fork shape. Smith's fracture. It's the transverse fracture of the distal radius. The deformity resembles a garden spade and is usually the reverse to the Colles fracture. This fracture occurs when there is fall on the back of the hand. Bennett's fracture is the oblique fracture at the base of the first metacarpal. Rolando fracture is also the fracture of the base of the first metacarpal. Boxer's fracture is the fracture of the neck of the fifth metacarpal. The arrow is pointing towards it. This occurs during the punching movements of the boxer. Let's study about the shoulder joint. Shoulder joint is known as the glenohumeral joint. It's a synovial joint of the multi-axial variety. The movements happen in all directions. It's highly mobile but less stable. The articular surfaces are the head of the humerus and the glenoid cavity. Both the articular surfaces are covered with hyaline cartilage. The movements happening at this joint are the flexion, extension, abduction, adduction, internal rotation, external rotation and circumduction. That is why it's highly mobile. The stability of the joint is increased by the fibrous capsule, synovial membrane, glenoidal labrum, glenohumeral ligaments, coracohumeral ligament and the transverse humeral ligament. You can see the rotator cuff muscles, the supraspinatus, infraspinatus, teres minor and the subscapularis supporting the joint from all ends. Whenever there is a tear in this rotator cuff, there is pain and limited motion of the joint. When the ligaments get laxed, the shoulder joint gets dislocated. Usually the inferior dislocation is common, and when it happens so, the axillary nerve gets injured. Inflammation of the bursa around the shoulder joint is bursitis, causing pain and restricted joint movement. Further, the bursitis can develop into a frozen shoulder, which is nothing but the adhesive capsulitis, inflammation of the capsule, and there is adhesion. Slowly there is scar formation and restricted joint movement with lot of pain. This is the adhesive capsulitis. Another one is the impingement syndrome. The supraspinatus tendon can get caught or impinged at the coracoacromial arch. This again causes pain during abduction. This is another picture showing the bursitis, the inflamed coracoacromial bursa. With increased age, there are a lot of osteoarthritic changes. Let's study about the elbow joint. Elbow joint is a hinge variety of the synovial joint. It's a compound joint because the humerus, radius and the ulna are involved. The ligaments are the capsular ligament, ulnar ligament and the radial collateral ligament. The ulnar collateral ligament, you can see here, there are anterior band, inferior band and the posterior band. The radial collateral ligament merges with or blends with the annular ligament, and this is the capsular ligament. Supracondylar fracture of the humerus can occur. There can be dislocation of the elbow. If a child, when pulled sometimes, the radial head gets dislocated, and this is known as pulled elbow. Olecranon bursitis. This is called as student's elbow. This is inflammation of the olecranon bursa. Inflammation of the medial epicondyle is called as the golfer's elbow. Inflammation and pain over the lateral epicondyle is called as the tennis elbow. Let's see the wrist joint. Wrist joint is a biaxial ellipsoid type of joint. It involves the lower end of the radius, the scaphoid lunate and the triquetral bones. Ligaments are the capsular ligament, radial collateral ligament and the ulnar collateral ligament. Again, Colles fracture, already described earlier. It's a Dinner-Folk deformity. Smith's fracture, reversal of the Colles fracture. There are three radioulnar joints: superior radioulnar joint, the middle radioulnar joint, which is nothing but the interosseous membrane connecting the two bones, and the inferior radioulnar joint. Intercarpal joints, these are plain joints. Midcarpal joints, between the proximal and the distal row, again this is a plain joint. You can see the arrow here. This is a scaphoid bone which can get fractured when there is fall on the wrist in the extended position. Saddle joint, the first carpometacarpal joint of the thumb, is a saddle or sellar joint. Metacarpophalangeal joints are condylar joints. Interphalangeal joints are hinge variety of joints. Lastly, let's see what's mallet finger deformity. There is an injury to the extensor tendon and hence you can see the flexion of the distal finger. This is called as mallet finger. Thank you.